Hi, everyone, and welcome to our February research briefing. I'm Vanessa Weisbrod from the Celiac program at Boston Children's Hospital, and we have our amazing research director, Jocelyn Silvester, with us here as usual. Today, we are going to talk about research that comes from the Celiac Center at Colorado Children's Hospital and is part of the Autoimmunity Screening for Kids, or ASK study. Before we jump into the specific findings of this paper, Dr. Silvester, can you tell our listeners a little bit about the ASK study?
Yes, absolutely. This is a really important study that's going on in Colorado that's asking a question that we really don't have enough data to answer correctly, which is it worthwhile to screen children for autoimmune conditions? Specifically, they're looking at type 1 diabetes and celiac disease. And this is hopefully going to help us know whether or not we should recommend screening, because right now, the U.S. Preventative Task Force, which is the group that decides whether things should be covered in the United States, says there's not enough evidence. So this is part of the motivation for this study, which is a large study screening children who are in the community for celiac disease and type 1 diabetes.
Great. So the most recent paper from the ASK study is published in the American Journal of Gastroenterology. Can you tell us what the researchers found and what this tells us about celiac disease in kids?
Yes. So what these researchers did is they recruited over 10,000 children from the Denver area, and they actually enriched for the Hispanic population, because we know we don't have as good data for celiac disease prevalence in the Hispanic population, and they screened them all for celiac disease and type 1 diabetes. This particular study looks specifically at celiac disease, and they used two different types of assay. One is a radiobinding assay, which is a little bit more fancy than what we use clinically. And then they confirmed the positive results using the same type of assay that we use clinically. And so what they were looking for, their primary outcome, was how many of these children had positive celiac antibodies.
So out of all of those kids that were screened, there were 242 of them who were identified as having markers for celiac disease. Did all of them have symptoms of celiac?
No, actually, this is what was really interesting and helpful about the study, because screening is different from diagnosis, because when you're screening, it's sort of like colon cancer screening or breast cancer screening. You take everybody. And when you're doing a diagnosis, you're focusing on the symptoms, people with symptoms. So symptoms weren't a requirement to participate in this study, but they did have everybody fill out a symptom questionnaire. And 30% of the participants had symptoms, and it was the same number whether they had celiac disease autoimmunity or not. So 70% of those with positive antibodies didn't report any symptoms.
That's so interesting. So does this study tell us anything unique about the kids who were diagnosed with celiac disease? Were they similar in age, gender, or race?
So it confirmed what we already knew, which was that risk factors for celiac disease are having a family history of celiac disease, although 90% of the children who had celiac autoimmunity did not have a family history, that in this age group it's more common in girls and boys, and that there's a lower rate in the Hispanic population than the non-Hispanic population.
Do the results of this study suggest that we should be screening all kids for celiac disease, perhaps as part of their kindergarten wellness exams?
So that's a good question, and I think it's important to remember that this was a study that included kids from age 2 to 17. And what's really interesting about celiac disease is what you inherit and what you're born with is the genetic risk. But you need some other event in order to actually develop the disease. And that can happen at any point in the lifetime. So it's not clear really what the best age to screen might be. Also, it's not clear, this was looking at the rates of celiac disease autoimmunity, but when we think about screening programs, one of the criteria for a screening program being worthwhile are that it's going to improve outcomes. And that's the sort of longer term follow-up that we're hoping to see more of from this group, and they are following these patients, so hopefully we can learn more about that. I think what's interesting to note is that there was a substantial proportion of people who were contacted with a positive screen who did not follow up. So 25% of those who had a positive screen didn't come back for confirmation. And some of those kids ended up being put on an impaired gluten-free diet. So this group is really getting into the mighty details of what's happening to each of these children, which is really important, because it's not a simple outcome of you have celiac disease or you don't have celiac disease. As everybody who is familiar with celiac disease knows, there's lots of gray areas and it's not always as clear.
Absolutely. So, previous research has shown that the presence of symptoms is a poor indicator for a child having celiac. But some parents argue that if their child doesn't feel sick, why should they test their child for a disease, let alone change their diet? How do you respond to parents who say that mass screening isn't necessary?
Exactly. And this is where it's important to show that there's a benefit. And benefits can be at different levels. They can be a benefit to the healthcare system, they can be a benefit to the patient, or they can be both. One of the things that's striking about celiac disease is we're often told that it took a while to get to the diagnosis. And so shortening the time to diagnosis is probably helpful for those who have a delayed diagnosis. Also, particularly important in children is because children's bodies are changing all the time, often they don't know that something's not right until it gets better. Because they're adapting to change, they don't know if these changes are healthy changes or not. So I think there's probably more of an argument for screening an asymptomatic child than an asymptomatic parent. Although the long-term complications of untreated celiac disease are going to be the same. Also in children, if they're not absorbing well, then that's going to affect their growth and their final adult height.
Great. So, this is obviously just one of what will hopefully be many studies to come from this group. So, what do you hope is to come from additional data collection in the coming years from this ASK study?
So, I think one thing that would be really interesting would be to rescreen these children, because we know that there's not everybody gets celiac disease at the same time, but we don't have good data in a general risk population. What's interesting about this study is that they didn't screen everybody for celiac genetics like they have in the TEDdy study or other cohort studies where they've only looked at risk children. This is the general population. So some of the people they were testing were probably not at genetic risk. And so it's interesting to see what the rates of seroconversion, that is going from having a negative test at the first visit to having a positive test at the follow-up visit, will be. Also, I suspect we'll get more information about the impact, as you asked, about the quality of life on these children who are detected, because that's a really important question. And we're learning from screening in adults, particularly things like breast cancer screening, that we really have to think through the consequences before we start a screening program, because it's not always as simple as it first appears.
For sure. And I hope we have lots of big things to see coming out of this group. Well, thank you so much, Dr. Silvester, for joining us again this month, and we'll see you all again next month.